Pilonidal sinus. Pilonidal sinus is a very common condition which we encounter in young people. Generally, these patients come with complaints of a small boil or a swelling in the lower back or in the upper part of the buttocks, which ruptures, releases some blood and some pus, dries away, again comes back after 3 or 4 months, and this process keeps repeating. Initially, many people ignore this thinking it's a small skin boil, and once it starts coming repeatedly, then their attention is drawn to that. This condition is called pilonidal sinus. Why does it happen? A pilonidal sinus is actually a tunnel which goes from the skin level deep down into the tissue. At the end of the tunnel, usually you find a small tuft of hair. The hair from the back, which usually sheds naturally, gets sucked into the skin pores of the buttocks. And when this hair gets trapped there, it creates a sort of inflammation around itself and starts tunneling down. And many times, because of the dirt and the other debris, this becomes infected. And when the infected material finds its way back to the skin and ruptures, it forms pain and pus discharge. How do we treat pilonidal sinus? At acute condition, when the patient comes with infection and pus, this problem is treated with the help of antibiotics. But that is not a permanent cure for the sinus because the tunnel is way deep into the skin. The permanent solution is surgically removing the sinus from the skin level deep down into the tissue to the end of the tunnel where the tuft of hair, which is like the seed of the infection, lies. And once the entire sinus is removed, then this problem is cured permanently. Traditionally, this involved a very major operation whereby a large amount of skin is removed along with a deep tissue which leaves a large defect. And this defect is either covered by directly suturing it or by means of creation of a flap which is rotated by a plastic surgery method and the gap is covered. Recently, there has been a large interest in the use of laser technology for the treatment of pilonidal sinus, wherein without creating a large wound or the need for a flap, the entire sinus is first cleaned and a laser beam is passed into the sinus and the entire tract is ablated or destroyed by the help of a radial laser fiber. The advantage of this procedure is one avoids a large wound, a long recovery time, and generally these patients can go back home the next day after the procedure.